Welcome to Pathways to Wellness with Dr. John Wycoff. This is a podcast that allows you to learn how to take charge of your health and wellness and do it naturally. That's what we're all about at Wycoff Wellness, is finding natural solutions for chronic health problems. So we use a functional medicine approach. That's an approach where we try to find the root cause of what's going on with your health and try to get that problem solved. So today we have a fascinating topic. We're going to talk about a problem that occurs with the COVID-19 vaccine and the spike protein. You probably have heard of the spike protein. It is injected into you with each vaccine, and it can cause all kinds of damage. And again, this is something that conventional medicine is just beginning to understand about the damage that the mRNA vaccine with COVID-19 did. And if you remember all the fervor of the COVID-19 hysteria, several years ago when we were in the epidemic, there was this rush to get a vaccine developed. And the reason the vaccine came to be so quickly was because of mRNA technology. And that was a totally different type of technology for vaccine production. And we were sold on the fact that this was going to be safe, effective, and we could develop it in a fraction of the time. Well, vaccine production had been time-tested for decades, but it always took time. Time to do studies, modify the vaccine. It would take years, 5 to 10 years, from vaccine development to vaccine production. The introduction of the mRNA allowed things to become quicker, but unfortunately did not allow us to get to efforts to really look at the side effects. So what we're finding, and this is conventional medicine, is that people that had COVID-19 and had the vaccine, both had COVID-19 and had the infection, were exposed to the spike protein. And if that spike protein can remain in the bloodstream, maybe forever, but certainly for years, and that the spike protein would cause damage. It can damage any cell in the body, but it does seem to concentrate a lot of its damage on the heart muscle. And that's why you've seen concern about things like myocarditis. That's an infection of the heart muscle, even resulting in premature death of people who got myocarditis, pericarditis. Whenever you have an itis, it means you have inflammation. So what the spike protein does is it causes inflammation. Things also get inflamed like in your brain. So you get fatigue, brain fog, confusion, depression, insomnia, anxiety, all common symptoms related to the spike protein and the COVID-19 vaccine. So don't let your doctor just dismiss your symptoms. If you say, listen, boy, before I had COVID-19 or before I had the vaccine for COVID-19, I didn't have these symptoms. This isn't in your head. It's related to the reaction your body's having to the spike protein. So we're going to talk today about how to detox from the spike protein. That's what today's topic is on Pathways to Wellness. I'm your host, Dr. John Wycoff. I'm the founder and CEO of the Wycoff Wellness Center in East Lansing, 1226 Michigan Avenue, East Lansing, Michigan, 517-333-7270, 333-7270, or wycoffwellness.com. Learn more about us. Learn more about functional medicine, finding the root cause to your problem. Now, part of the issue with spike protein is that we don't have a test that measures spike protein. We do have tests that measure inflammation. So if your doctor's hesitant to get those inflammatory tests, things as simple as a CRP, a homocysteine, a sedimentation rate, find a practitioner who will do that for you. Those are the types of testing that we do each and every day at Wycoff Wellness. And you can detox from COVID-19 spike protein damage. It involves enhancing your ability to detoxify in general. Now, what I know in my practice is that we have people that are good detoxifiers and people that are bad detoxifiers. And you might say, well, that's kind of oversimplistic, Dr. Wycoff, but that's really the truth. So what decides if you're a good detoxifier? Well, there's really two things. One is your genetic predisposition. What kind of genes do you have that help you detoxify? The detoxification genes are called the methylation genes. And if you've not heard of methylation, methylation, Google it. And I encourage you to follow a person named Gary Brecka, Garybrecka. He's not a physician, but fascinating individual who really understands methylation. And you'll find him on YouTube, Facebook. He doesn't have a book, but you'll find him, follow him, listen to some of his YouTube videos, especially on methylation. So when we talk about detoxification, we're talking about methylation, getting rid of something that's in your body that shouldn't be there. So when we got the COVID vaccine, and believe me, there's a whole discussion about the politics of COVID vaccines, but unfortunately, many people were almost forced to get the vaccine or they'd lose their job. They thought it was going to reduce their risk of getting COVID. Unfortunately, none of that stuff was true. And now we're faced with a significant amount of the population, maybe 85, 90% of people got the vaccine, and they have risks then for developing spike protein damage. So the spike protein can affect anywhere in the body, not only the heart, but the brain, the intestinal tract, and it's a real problem. The spike protein can continue to cause damage for weeks, years. We really don't know how long. We just know that they are an enemy, that they may be in your body for a long, long time. And if you go to the literature and do a Google search on spike protein, you'll find a number of clinical studies that are talking about that, more and more of these peer-reviewed studies. So I encourage you to do that. This is a real thing. The spike protein affects the DNA in your cell. The mRNA is a type of DNA that can really mess up how your cell works. And that's the basis of what happens with the inflammatory response provoked by the COVID-19 vaccine. So what do we do at Wycoff Wellness? One, we go do a history and we find out what your symptoms are. Two, we do the right testing. We're going to get a routine metabolic panel, blood count, thyroid test, but then we're going to get those inflammation markers, maybe some hormone studies. And we're going to find out if those are right or wrong, or if those are a barrier to you feeling better, especially if you have symptoms like fatigue, insomnia, brain fog, confusion. And then we're going to put you on a multi-step program. Our program is pretty standard. One, we're going to do the most important thing you can do is helping your body to detoxify better. You start that with diet. It's the only way you're going to get there. You've got to give up grains, dairy, sugar. Eat more cruciferous vegetables, the dense vegetables like broccoli, cauliflower, Brussels sprouts, asparagus, more spinach, kale, sweet potatoes, bell peppers, carrots, tomatoes, nuts, and seeds. And drink plenty of pure filtered water. A guideline for that of water, I got my bottle here, a half an ounce of water for every pound of body weight. So if you're 200 pounds, that's 100 ounces, 3 quarts a day. That's a lot of bottles. 12-ounce bottle, 16-ounce bottle, it would be 6 or 7 of these a day. So for me, it's more like 8. So plenty of water. That's the basic way you help promote detoxification. There are some supplements that we recommend that promote how your liver detoxifies. Your liver is your big organ for detoxification. And toxins go through phases. They're transformed through what is called phase 2 and phase 3 detoxification. Phase 1, 2, and 3. 3 is elimination. But phase 1 and 2 occur in the liver and are very dependent upon supplements like NAC. So Metagenics, the company we partner with, has a product called Glutaclear. Great product to help promote detoxification. 2 capsules twice a day. Inflammatory intensive care. This is a powdered supplement that has curcumin and all of the types of nutrients that help your body detoxify, make more glutathione. We start out with inflammatory intensive care, 1 tablet twice a day, or a product called Ultra Inflammex. That is a powdered form that you can use as a meal replacement. Very powerful to help your liver go through phase 1, phase 2 detoxification. We use to couple that with a tablet called Aviclear, Inflammex, Ultra Inflammex, or Ultra Clear Detox, along with Aviclear. And those are products you can pick up at our office on Michigan Avenue in East Lansing at the Wycoff Wellness Center, or you can find online at wycoffwellness.com. Just go to our store and shop. So we need you to improve your ability to detoxify. We need you to produce more glutathione. Glutathione is the master antioxidant. It helps neutralize harmful free radicals and assists your body in getting rid of heavy metals, environmental toxins, and viral proteins, even the spike M protein. Unfortunately, the spike protein has been shown to deplete glutathione levels. Makes it very hard for your body to recover from this inflammatory process that's going on. So supporting glutathione with diet and supplements is critical. Things like Glutaclear, Ultra Inflammex, Ultra Clear Renew, Aviclear, Inflammatory Intensive Care. These are Metagenics products that we can get for you at our office or online, wycoffwellness.com. Eating the right foods like we talked about, cruciferous vegetables, spinach, berries, avocados, asparagus, foods that have turmeric, using NAC, glutamine, selenium, vitamin E and C, B vitamins, magnesium, zinc. All those things help you, especially if you have some methylation barrier, some genetic barrier to detoxification. And you can listen to my podcast on methylation and learn about how we can test you to determine if you have a methylation barrier. But if we identify a barrier, oftentimes we can fine-tune our recommendations as to supplements you should take or consider to help your body detoxify better. We can go a step further at our office and we can do more intensive treatments such as oxygen and ozone therapy. This would be more aggressive, more in the realm of functional medicine, but oftentimes your body needs this to get you to the place you want to be. A trial of MAH ozone infusions. This is where we take some blood. We take about this amount of blood is in this bottle of water, maybe 12 ounces, and we add ozone, a gas to it. The ozone breaks down quickly into O2 and then O1, a free oxygen radical. But the free oxygen radical really stimulates cellular health, will help restore your ability to detoxify. We can couple that with ultraviolet blood irradiation, easy sessions to do. Take about 45 minutes to an hour in our office. We do a few of those over a few weeks to try to stimulate your detox pathways and help you get rid of the spike protein. We also do things like far infrared sauna. 30 minutes in a medical grade sauna. We have one in our office. You come in, you disrobe in a private locked room. We set the sauna for the right temperature and the right time. You work up a good sweat, and then we immediately have you take a shower. Afterwards, we have a nice shower in our office and wash off and get the toxins that have come out of your sweat glands off your body. That can be a great therapy. It's refreshing, easy to do. And we also offer ionic cleanse foot baths. We can do this when you're doing a sauna or a UBI ozone treatment. You just put your feet into a foot bath, warm water, and we pass an electrical current and we pull things through your feet, pull out toxins through your feet. It's amazing the color change you'll see and can help you get on that road to health and wellness. So kind of the things that we try to promote from a functional medicine perspective is a diet It's high in cruciferous vegetables and antioxidant-rich fruit and vegetables, things that have curcumin, bromelain, turmeric, plenty of water to drink, supplements that like NAC, Glutaclear, Inflavonoid Intensive Care, Ultra Inflamax powder. I should mention, we actually have glutathione in a liposomal liquid form. Glutathione is a fickle substance. We can actually inject it intravenously into you at the end of a MAH ozone treatment or a UBI treatment, and we do that often, but it's not stable orally unless it's bound to a liposome. It's like a fat molecule. So we do have it available in a liquid form. You can take this orally, like a teaspoon every day. It doesn't taste real good, but you can mix it with some water or juice and support glutathione orally, or we can give it to you intravenously. Also a great way to support detoxification. You can get in our sauna. We can do an ionic cleanse foot bath. We get you on that path to detoxifying and getting through some of these spike protein problems. This is a root cause of inflammation in a lot of patients. It will help you get to a point where you detoxify better. Everyone can detoxify better. I do a formal UltraClear, AvaClear metabolic detox every year for at least 4 weeks. We can do a 10-day detox. We can do a 28-day detox. We have the products. We have the instructions. You just need to get the motivation, follow the diet, which is really just regular food. You've got to go to the market. Maybe you've got to go get some organic foods. But we can get you to a place where your body is detoxifying better. Detoxification is a very nutrient-dependent process. So we're going to push some nutrients on you big time. So if you want to learn more, go to our website, wycoffwellness.com. Check on detoxification. Call us at 517-333-7270, 333-7270, 800-471-0255. Stop by our office. You can shop our store. You don't have to be a patient to shop our store at 1226 Michigan Avenue in East Lansing. We're on the edge of the Michigan Avenue campus, our Michigan State University campus, just east of Frandor, about 4 blocks, and about 4 blocks west of the Harrison Roadhouse, corner of Michigan and Highland. Come in during office hours. We're open 7:30 to 5, Monday through Thursday. Talk with one of my staff. They're very knowledgeable. They can talk with you about our treatments. We have information in the office about our treatments, and we can help you get on that pathway to wellness. And you can keep listening to me, Dr. John Wycoff, on Pathways to Wellness. A lot of great topics in our library already, so please avail yourself to those. And until next time, here's to your health.